Welcome back to the deep dive. We're here again to, cut through the noise and give you those essential insights. Today we're focusing on Australia. It's got this real allure, hasn't it, for medical professionals around the world. You think about the cities, the lifestyle, practicing medicine in, well, a really top-notch healthcare system. It's a fantastic prospect for loads of international medical graduates, IMGs. But let's be real, the path to actually doing it often feels pretty complicated, like navigating a maze sometimes.
It really can feel overwhelming, that whole journey for IMGs. So, yeah, let's try and cut through some of that complexity today, give you a clearer map, so to speak.
Exactly. Our mission is basically to demystify how international doctors get registered to practice in Australia. We want to go step by step,
Yeah.
highlight the key requirements, pull out the crucial insights, and we're drawing heavily from our source today, the U shots.
Right, that's the Australia Doctor Registration Guide. It's originally in Japanese, which gives it a pretty unique and practical angle on the challenges, the strategies for IMGs.
Yeah, and we're going to distill that wisdom for you right now.
Okay, so the first thing to really get your head around is that while there might seem like lots of different routes, um, they all kind of funnel through one main body. Every single IMG wanting to work in Australia absolutely has to, register with AHPRA. That's the Australian Health Practitioner Regulation Agency.
AHPRA. Got it. So they're the gatekeepers, essentially.
Precisely. They're the mandatory body. They make sure everyone meets Australia's high standards, patient safety, quality of care, all that. It's not just about passing exams. It's a whole package of national requirements you need to meet.
Okay, AHPRA is central, definitely. But figuring out how to meet their requirements, that means picking the right pathway for you, right? For your background, your goals. And our source makes it clear it's not just one door. There are three main ways in.
It's exactly right. And they're designed, for different levels of training, different experience. Although something that often trips people up and isn't always obvious up front isn't just the exams. It's the sheer amount of paperwork, the admin steps. You really need meticulous planning from day one.
That's such a good point. The admin marathon can be just as tough as the academic one. Okay, let's break down those three pathways, starting with the most common one you said, the standard pathway.
Yeah, the standard pathway. This is generally for doctors who trained outside Australia or New Zealand, and they don't have specialist recognition yet. For them, the big hurdle is passing two exams, a written one and a clinical one.
Okay, and these are run by the AMC, the Australian Medical Council.
That's the one. And they are, let's just say they're pretty thorough, rigorously comprehensive.
Right. So that pathway is about validating that core medical knowledge and general skills against Aussie benchmarks, getting everyone on a baseline.
Pretty much, yeah. Then you've got pathway number two, the specialist pathway. As the name suggests, this one's tailored for specialists trained overseas.
Okay, so they don't necessarily sit those general AMC exams.
Generally, no. The key here is getting their existing specialist qualifications recognized, assessed by the relevant Australian Specialist College for their field. If that college says, yep, your training is comparable to ours, then registration in that specialty can follow. It's about acknowledging expertise that's already there.
Makes sense. Avoids redundant testing for established specialists. And the third one, you mentioned it's maybe the quickest for certain situations.
That's the short-term training pathway. This is really geared towards specialists looking for, say, up to 12 months of specific training in Australia.
Interesting. And what are the requirements like for that one? Sounds different.
It is quite different. The primary requirement, compared to the others, is much more focused. It's mainly about proving your English language ability. Solid proof.
Ah, but there's a catch, right?
There's a big catch, yeah. Our source really flags this. While it's the fastest way to get short-term experience, it absolutely does not lead to permanent registration. It's purely for temporary, focused training stints.
Okay, crucial distinction there.
And if you look at the bigger picture, these three distinct pathways, they sort of show Australia trying to match different international skills to its needs, but also keeping those standards really high. It shows that even for short-term roles, there's a fundamental skill set needed across the board.
And I think I know where you're going with that.
Mm.
That fundamental skill, it's the one thing that unites all pathways, and it can be a real hurdle. English proficiency.
Exactly. Strong English skills are just non-negotiable. Doesn't matter which pathway you're on. It's not just, ticking a box. It's fundamental for safe patient care.
Right. And HPRA, the main body, they accept a few different tests for this.
They do. You've got options. There's IELTS, OET, TOEFL, IBT, and PD Academic.
And our source mentioned they each have their own sort of quirks or challenges.
Yeah, it gives some interesting insights, like IELTS is obviously well known, but apparently candidates often find the writing and speaking bits tough for medical contexts. They aren't always clinically focused, you see.
Okay, so maybe less relevant practice.
Potentially, yeah. And then PTE academic, well, it gives you results quickly, which is great, but being computer scored.
Ah, the accent issue.
Sometimes, yes. The automated system can sometimes struggle with certain accents, which, can feel pretty unfair if you're perfectly clear,
Hmm.
but the machine doesn't quite get it.
Yeah, that would be frustrating. Which really underlines how important choosing the right test is. It's not just about passing, but passing fairly.
Precisely. And this leads us to what the guide highlights as often preferred by IMGs, the OET, Occupational English Test.
Because it's healthcare focused.
Exactly that. The writing, the speaking casts, they're based on real medical scenarios. Doctor-patient consultations, referral letters, that kind of thing.
So it feels more relevant, more practical.
Much more so for
Yes.
many doctors, yes. It feels less like just a language test and more like, I don't know, a bit of a practice run for the actual job communication. It kind of subtly prepares you for the way conversations happen in Australian healthcare settings, which could be different. Patient-centered communication is key.
So choosing your English test. It sounds like it's a strategic decision, not just about proving you can speak English, but about feeling confident using it in those specific medical situations.
Absolutely. Ensuring clarity, empathy, all crucial.
Okay. So English proficiency is sorted, hopefully. Now let's loop back to the standard pathway. You mentioned those 2 AMC exams. Beyond English, these are the big ones for that route.
They really are. Let's dive into those. First up is the AMC MCQ examination. MCQ multiple choice questions.
How many questions are we talking?
It's 150 questions,
Mhm.
and it covers a really broad range of medical knowledge. Think about what a general practitioner in Australia needs to know. So medicine, surgery, pediatrics, O&G, psychiatry. It's all in there.
Wow, 150 questions covering all that. Sounds intense. Is it just pure knowledge recall, or is there more to it?
That's a good question. People often assume it's just recall. But the trick is, the questions often frame things in a specifically Australian clinical context. So it's not just what you know, but how you'd apply it following Australian guidelines or common presentations here. That can be a subtle shift for IMGs.
Right. The local context matters. How do people generally do on it is a massive barrier.
Well, here's some potentially good news. Our source notes, the pass rate is actually quite decent, usually around 70%.
Oh, 70%. That's actually quite encouraging.
It is. It suggests that, with proper focused preparation, most candidates can get through it. It's achievable.
Still, 30% don't pass. What usually makes the difference, do you think?
Often it's about understanding that style of question, applying knowledge to scenarios, not just rote learning facts, and really drilling into those Australian specifics. But then comes the second exam, the AMC clinical examination. This is where the practical side really gets tested.
The one with the simulated patient.
That's the one. It's structured around 16 different stations. You go in, interact with actors, playing patients with various conditions or scenarios.
16? That sounds like a pressure cooker. What are they looking for there? Just diagnosis and treatment plans?
Well, yes, clinical skills are obviously key: diagnosis, management, but it goes way beyond that. They put a huge emphasis on communication, professionalism, how you interact with the patient, explain things, show empathy.
And our source mentioned this one is seen as more competitive than the MCQ.
Definitely. It's often perceived as tougher, not just because of the clinical knowledge, but precisely because of that heavy weighting on communication and, frankly, cultural competency. You need to show you understand and can operate within Australian patient expectations and communication styles.
So practicing those interactions, maybe with people familiar with the Australian system, would be crucial.
Absolutely vital. It's not enough to just know the medicine. You have to practice demonstrating your communication skills, your empathy in that specific context. That can be the biggest adaptation for many IMGs.
Okay, so for anyone on that standard pathway, it's like a 2-stage challenge. Nail the broad medical knowledge for the MCQ, and then prove you can apply it safely and effectively with real people or simulated ones in the clinical exam.
You've got it.
And it all comes back again to that strong English foundation, doesn't it? Especially for the clinicals. Clear, empathetic communication is being directly assessed.
Couldn't agree more. You can know all the medicine in the world, but if you can't communicate it effectively and build rapport, you'll struggle in that exam, and more importantly, in practice.
It really highlights the holistic approach they take, doesn't it? It's not just about book smarts.
Not at all. It's about ensuring doctors are ready for the realities of practice in Australia, knowledgeable, skilled, and able to connect with patients. It's about safety and quality.
Right. So there we have it, a pretty detailed roadmap, I hope, for navigating medical registration in Australia if you're an IMG. We've covered HPRA as the main body, those three pathways. Standard, specialist, short-term training, the absolute need for solid English skill.
And the specific tests, yeah, with a look at OET maybe being a good fit for many.
Exactly. And then we drill down into those AMC exams for the standard pathway, the broad MCQ, and the very practical, communication-focused clinical exam. Like, it's clearly a thorough process, no one's denying that. But hopefully this deep dive shows it is navigable.
Yeah, with the right information and good preparation, it's definitely achievable.
We really aim to give you that clearer map today, cut through some confusion, and point you towards what really matters.
And it underlines that the rigorous requirements are there for a good reason, upholding healthcare standards for everyone in Australia, while also, trying to integrate valuable international talent effectively.
Absolutely. So maybe a final thought to leave you with as you digest all this. Considering the tough preparation, the different routes, how could you, as a future international doctor, not just tick the boxes and meet these requirements, but actually use your unique background, your diverse training, your different experiences? How could you leverage all that to genuinely enrich the Australian healthcare system? Go beyond just filling a role?
Hmm. That's a really powerful question to consider, bringing your whole self, your unique perspective, into this new system.
Something to think about on the journey ahead.